Hello, I'm Glenn W. Hunter of Hunter and Beyond LLC, and this is Dr. James George of Excel Physical Therapy and Wellness. And today's topic is homeopathy and insomnia. Dr. George, are you ready to have another riveting conversation as we just continue to explore all the abilities that you have in serving patients through homeopathy?
Of course, yeah. We want to help patients. We want to help people with different chronic ailments. There are many people who do not know what to do. Yeah, that's why we are here to educate them and also to help them with treatments.
Indeed. Well, with that in mind, let me ask you, let's just talk about patience. I mean, to the layperson, insomnia is the equivalent to, I just can't go to sleep. But life is rarely that simple. From your professional perspective, what is insomnia?
Anyone who is not able to get at least 6 to 8 hours of sleep, it's not about like a oh, I am able to sleep for a few hours. It's about uninterrupted 6 to 8 hours of sleep. It is called insomnia, and many people say that, oh, I go to sleep, but then I wake up after 2 or 3 hours. That is also insomnia. And people who are not able to go to sleep and they're just keeping their eyes open and they try to go to sleep, they're not able to go to sleep because of a lot of thoughts going on in their mind. So there are many reasons for not having be able to go to sleep or not able to have a continuous sleep. That is insomnia.
I see. So, with your experience as a healthcare professional, what are some of the causes of insomnia?
Many times it is, when you have some certain foods which have high sugar in it, or you have alcohol, you have like a spicy food right before you go try to go to sleep, or caffeinated drinks. So all these could cause somebody to not able to go to sleep. But these are only very few reasons. There are lot many reasons for people not to be able to go to sleep or to have a continuous sleep. And sometimes even not having enough minerals in their body, vitamins, or the body is not absorbing those minerals. That's where homeopathy can help. And certain people, they are not able to go to sleep because of a lot of thoughts in their minds of what's happening in their lives. Even the pandemic is causing that, and even things that are not able to do their jobs or their day-to-day activities well. So there are many reasons for somebody not able to go to sleep.
Okay. So, what suggestions would you give to your patients to help their sleep?
So yes, to avoid high highly spicy food, or to avoid alcohol, to avoid caffeinated drinks before you go to sleep. Some people, very few people, could be that hypoglycemia, they're not having enough blood sugar in the body, or people who are on insulin, or who are taking medicines to lower the blood sugar. If they have not timed their meal and their medicines well, they may end up in hypoglycemia. That could also cause them not to be able to go to sleep. So you need to look into all these things. That's why we provide a consultation to look into all these. Also, as I said, certain deficiencies in minerals like magnesium, certain like proteins like tryptophan. And serotonin, like you need tryptophan to produce serotonin, and serotonin is a feel-good hormone. So, and 95% of your serotonin is produced in your gut. So being able to eat, you need to eat healthy food. Sometimes the foods which cause bloating and indigestion, constipation, or diarrhea, all these things can also cause somebody to not be able to go to sleep.
See, okay. Wow. So coffee and insomnia have a strange counterintuitive relationship. What message regarding insomnia do you have for our coffee drinkers?
Coffee is a neurostimulator. Yes, drink coffee in the morning to wake up and to be able to go to work, go to school, study, everything, do your day-to-day activities. But having coffee in the evenings and at night actually causes you people to not able to sleep well. And coffee is known. See, we have a hormone called cortisol in our body. It is a steroid hormone. You need that more in the morning to be able to do your work, and that's where coffee helps. But coffee, when taken in the evenings, it shoots up your cortisol level, and that could cause somebody not to be able to go to sleep. So, yeah, having coffee in the morning is okay, but try to avoid taking too much coffee before you go to sleep. Counterintuitive.
Very straightforward. Okay. So I guess the next question I have is, how would you describe the relationship between stress and insomnia?
Yes, we need to understand that when people are stressed, they don't produce enough serotonin, which is the feel-good hormone. Now, stress could be, we all know, like a chronic stress because of like this pandemic, and people are in their homes. Many are not going out because of chronic health problems, and many have job-related issues, and all of these, and people are many. You see a lot of people in their home, that could also cause stress. So this, yes, it is very much correlated to not able to go to sleep. Uh, so that is why we need to do things to help improve your serotonin level in your body, and that's where homeopathy comes. Homeopathy naturally helps you to help deal with your stress and help improve your production of your serotonin level, and in turn helps you to go to sleep better. We have a lot of remedies in homeopathy which can help you with dealing with stress and to improve sleep.
I see. I see. Well, moving on to more physical symptoms, how would your patients describe the relationship between breathing problems, insomnia, and physical therapy, as opposed to how would you describe the relationship?
Yeah, so when you breathing problems, like people who have breathing problems, especially when they have COPD, like some issues or allergies. So yes, when the typical and normal way of breathing is diaphragmatic breathing, where you when you breathe in, your abdomen comes out, and when you breathe out, it goes in. So that is the best form of breathing, where your energy requirement to breathe is less. So when you're sleeping, you don't want to be expending too much energy. When you expend too much energy, like especially in asthma, you are using your muscles of your ribs and your upper part of your body, your chest. So what happens is that could cause somebody not able to go to sleep. And physical therapy, what we do is we train people how to breathe properly, use their diaphragm better. And homeopathy helps to help heal allergies, as we have discussed in the past videos. And it all works hand in hand. So a combination, or we call it integration, of homeopathy, physical therapy, and nutrition counseling can help people to breathe better, and as a result, they can go to sleep better as well.
Very good. Very good. Okay. Well, chronic pain problems have led people to resort to opioids, and it is a crisis in our culture. Does homeopathy have a solution for chronic pain and insomnia?
Chronic pain, yes, people have been taking opioids to go to sleep, and we know that it is addictive. But there is a place for opioids when somebody has acute pain. To get the edge over the pain, people take opioids, but taking it for a long time has its own side effects.
Hmm.
Homeopathy is natural, and the remedies in homeopathy which can help heal chronic pain. We have discussed in the previous video fibromyalgia and chronic fatigue syndrome. Homeopathy can help heal those chronic pain issues. Now, people with chronic pain, they are going to have difficulty going to sleep. Now, many times, so we know that the pain is felt in the brain, but there are people who have musculoskeletal problems, tight muscles, stiffness of joints, which is cause pain. So where physical therapy can help loosen up the joints and stretch the muscles. But people with chronic pain, for them, homeopathy can help. So integration of physical therapy and homeopathy help people to heal or deal with chronic pain, and in turn help them to deal with their insomnia issues as well.
I see. So on a similar thing, what are some of your suggestions to help people have a more restful sleep?
Yes, as we discussed earlier, you know, you need to have serotonin. That's the main thing, and melatonin, right? Melatonin also helps people to go to sleep better. Um, but we have seen that even people who take melatonin and who take care of their gut, your gut is where the serotonin is produced, 95% of serotonin. So, taking probiotics can help. But we have found some people still they have difficulties going to sleep. That's where homeopathy comes. Now, one of the homeopathic remedies is coffee cruda. Now, it is coffee actually. Homeopathic principle, one of the principles is like cures like. So coffee causes people not to go to sleep. That's why people drink in the morning to be able to wake up and go to work. But too much coffee can cause people to not sleep. But one of the homeopathic remedies is coffee cruda. But homeopathy is an individualized medicine, individualized treatment. So coffee cruda may help for somebody. So you don't like maybe 1 in 100 people could be benefit from coffee cruda, but there are many remedies in homeopathy which can help somebody to go to sleep. It's all about uh, performing a homeopathy consultation and finding the correct remedy which can help that person to sleep better. So all these things. So basically, certain foods like eggs have a good amount of tryptophan, which can be converted to serotonin. People who like pineapples and fruits, pineapple, bananas, apples can also help people to go to sleep better. So so lack of magnesium lack of melatonin can cause somebody to have not enough sleep. So there are many reasons. That's what we do. We consult with the patients. We find out what the issues are, and then we advise what supplements to take, and above all, what homeopathy remedy, the correct homeopathy remedy to take. And of course, physical therapy to help with musculoskeletal pain issues can also help. So it's like what we do here is integration of everything to help people to have a good night's sleep.
Wow. Again, I'm just impressed with the breadth of the services and the insight that you're able to bring to basically health challenges that affect many of us. So, Dr. George, how do we contact you?
Yeah, the best way to contact us is to call us at 909-792-5050. And you can also Google us, Excel Physical Therapy and Wellness. And you can find us and find our website, excelrehabandwellness.com. So there are 3 ways to contact us. You can shoot email or call us as well. Or we can help you set up an appointment, and before you come, we send you a questionnaire to fill up. When the questionnaire asks about all your head to toe health issues, mental, emotional, physical issues, then it makes it easier to when you come for consultation to be able to provide you a treatment plan, help you with going to sleep and to maintain a good sleep of 6 to 8 hours through the night.
There we go. Well, again, I'm Glenn W. Hunter. That is Dr. James George. And we want to thank you for joining us as we talked about homeopathy and insomnia. Reach out to Dr. George. He's helping lots of people throughout the Inland Empire. We'd like to include you as well. Also, subscribe to this podcast. So again, this is Glenn W. Hunter and Dr. James George, reminding you all to be safe, be healthy.
Thank you.